Hi, welcome to Healthcare Information System subject. Now we are in chapter 2. uh, Today I will share with you about the history and evolution of healthcare information system. Uh, so this chapter is uh, to enable you all to describe the history and evolution of healthcare information system. Start from the 1960 until 2020 plus, yeah, to the present here. So this chapter also to enable you to identify the major advance in information technology and significant initiatives that influence the adoption of healthcare information system. So healthcare information is very unique and widened area. Uh, so there are specific technology, especially the ICT. What is the element of ICT that can automate uh, the healthcare services? Yeah, then when the technology bring in into the business of healthcare information, healthcare services. So there are many barriers, and we have to find the adoption factor for the organization to use the HRS, healthcare information system. So another learning objective of this chapter is to be able to identify, to make sure that you can identify the major type of administrative and clinical information system used in healthcare. By uh, by browsing the chronicle chronological history of the healthcare information system, so it may give you the exposure, what happened in the past, and uh, why the his is very difficult to adopt in healthcare. Yeah, why ICT is very difficult to be adopted in the healthcare services. And then lastly, we want you to able to discuss why ICT adoption rate are lower in healthcare compared with other industry. By looking at the history, so you will understand uh, why the adoption of ICT is very late in the healthcare services. Okay, so the previous chapter we talked about introduction of the healthcare information system. So before we go in, uh, before we go inside of the healthcare information system, especially on the healthcare data, what is the major data to be included in the HRS? So it's better that we discuss and we uh, discuss with you about the uh, history of the healthcare information system or health informatics uh, in the healthcare services. So in this chapter, we build upon fundamental concept and introduce healthcare information system, a broad category that include both administrative and clinical application. Uh, we describe how healthcare information system have evolved during the past 60 years. Yeah. So in this chapter, also we discuss on the evolution that attributed to the environmental factor, changes in reimbursement practice, and major advance in information technology. So over the years, the healthcare executive role and involvement in making information system related decision have also changed considerably. So we discuss these changes and conclude by describing the challenges many organizations face as they try to integrate data from various healthcare applications and to get clinical and administrative applications to interoperate or talk with each other. Okay, what I mean is the fundamental concept in the healthcare information system. Uh, Before you go to the healthcare information system, so you need to understand, yeah, the history of the healthcare healthcare information system, because it will help you to understand, yeah, uh, why we need ICT in healthcare and why healthcare uh, very late to adopt the ICT in their process. Okay, before we go into the detail of the history of the healthcare information system, there are many terms that use in the healthcare business process. Yeah, so different discipline, so they use a different terms. For example, if you are in the banking system, the term used in the banking system is different. Yeah, you always said the passbook, yeah, current account, saving account, and then and nowadays we don't use a passbook, so we use a bank statement online. Yeah, and then we always talk about the available balance, yeah, floating amount, uh, check amount, floating the freezing amount, and so on. So same with the healthcare services. Okay, they have their own term when they communicate between healthcare professional or between healthcare professional and administrator people. So health worker interact frequently with professional from a variety of discipline and may find the terminology used confusing or intimidating. So they use the term normally if the worker, the health worker is trained from the perspective of medical, so they will not have the problem when communicating with the healthcare professional, example the doctor, specialist, staff nurse, and so on. So even professional within a single discipline often use different terms to describe the same concept and the same term to describe different concept. So when the doctor talk to the doctor, so they use the common term in medical. For example, a procedure, yeah, uh, chief complaint, yeah, medication, treatment, uh, what they call it, when patient register to the clinic or hospital, they call it episode. Yeah, when the patient see the doctor, they call it encounter. Yeah, when the patient go to the lab, so another counter. When patient go to the radiologist, that is the another kind of encounter. They call it encounter. So when you visit the hospital, they call it episode. So within the episode, they have many encounter. So let's say you register uh, for the day. So your registration for the day, they call it episode. Then when the nurse send you to the doctor, they call it encounter for that episode. And then when the doctor send you to the lab or radiology pharmacy, so there are they are the encounters. Yeah? So throughout this subject, we will use a variety of terms related to the information system. So our goal is to expose. My goal is to expose you to many of the information technology related terms you are likely to encounter in discussion with your health worker professional or with the information technology staff and IT savvy healthcare professional. So when you involve in such a big system like total hospital information system, so this is a people uh, that you will communicate. Yeah. Uh, of course, very frequent is with the end user. The end user is a health worker, either the doctor or staff nurse, a matron, medical officer, pathologist, oncologist. So you need to understand the term that they use. Yeah. So from my experience, I take about 3 years to learn the business process and also the term used in the medical process. Yeah. Example, like I said just now, when the doctor and patient do a consultation, yeah, when you seen the doctor, so first word they will ask you, what is your problems? Yeah. So this is a complaint. So you will tell the doctor, okay, I got dizziness. Okay, the dizziness is a complaint. I got vomiting, for example. So this is a complaint. So doctor will write down, jot down all your complaint, and then they will ask you about the past medical history uh, that you may got, or what is the history of medical for your family and so on. So of course, when the doctor talk with the patient, they use a layman term. Layman term. Uh, they will ask you what is the drug that you consume. Yeah. So in the doctor, within the healthcare workers, they will talk about medication. Yeah. Active medication, for example. uh, when the medication is started, they call it onset. Yeah, onset date, offset date, and etc. So they have a term. So you, as a IT professional, so when you enter into this discipline, so you have to know the term used in this discipline. Yeah, if you work with the accountant, of course you need to uh, understand or learn about the term in accounting, in financial. So you have to understand what is the GL, what is the profit loss, profit and loss, what is the GL, what is the AP, what is the AR, and so on. So thus, a healthcare information system is an arrangement of information processes involve people and information technology that interact to process, to store, and to provide as output the information needed to support the healthcare organization. So from the communication and term that people involved in this process, so the main uh, input and output is the data. Yeah. So you need to understand the process and you need to understand the term so that you can develop an application, uh, so the health worker can capture the information easily into the system. Yeah. uh, it is difficult. Yeah, if you don't understand the process, you don't understand the term language used by specific discipline, you may not understand the system. What I mean is a healthcare system. so that you very difficult or you misunderstood, and then you will come out with the wrong design. Yeah. uh, Maybe you can produce the application, but your application is a computer science healthcare information system. Yep. Okay, so you need to understand the terms. So along this subject, a lot of term in clinical and also the administration in healthcare will be used. Okay, so this is the beginning of the history. We don't start the history and evolution of information system in ICT. So I like to stress you on the term to be used and so on. And if you understand the term that we use in healthcare information system or healthcare uh, industry, so it's easy to discuss in the next chapter. Okay, there are many terms will be used along this subject. So to simplify and to ease the understanding, we will assume that the information in is made up of both raw and processed data. Raw is a data entered by the doctor, for example, vital sign information, your blood pressure reading, okay, systolic, dystolic, your pulse, yeah, that is a raw data. And doctor will enter your respiratory rate, yeah. They will enter your blood glucose, that called raw data. And processed data means the data will manipulate, will compare compare with the range of for example, range of the blood pressure. Yeah, they have a chart, so we process it. Let's say 140 is higher, less than 140 is normal higher, for example. Okay, from that data, from the uh, range of the data, so we call it processed data. We compare, uh, and then we can get uh, the status of your healthcare, your health status. Yeah. Okay. That data, raw data and processed data, is actually come from two primary classes of his. Yeah, administrative application and clinical application. So this is two major application in his healthcare information system. So the things that relate to the administrative, uh, in terms of the non-clinical data, so that fall under administrative, and all the medical and clinical data is under clinical application. Okay, a simple way to distinguish administrative and clinical application is look at the purpose of the function, the purpose of the type of the data they contain. For example, financial system and administrative system, such as finance, personnel, stock, material, supply, and equipment. So this is all administrative. So clinical application contain clinical data from various departments within or inter healthcare organization, such as from doctor-patient consultation. Normally we call it CIS, clinical information system. Radiology, laboratory, operation theater. Okay. So this is a clinic data that generate from the clinical application. Okay. So this is definition of term that you will you will use along this subject. Discharge summary, electronic medical record, encounter date and time, episode date and time, episode care. Yeah, health. When we talk about health facility, is a hospital. Yeah, hospital or clinic or blood center. Let's say IJN. Uh, Institute of Jantung Negara in Kuala Lumpur. That consider health facility. Any organization or any facility that give a service of healthcare to the patient, they call it healthcare or health facility. Yeah. So health record, what is health record? Healthcare professional. When we talk about healthcare professional, so you can imagine that healthcare professional is a doctor. Yeah. Doctor or certified nurse. Doctor got many level. Yeah. GP, general practitioner, is normally this doctor is graduated from the university, yeah, which still not specialized, not going to specialist practice. So normally this doctor is a general practitioner, general doctor. Okay, and then we got specialist, senior specialist, consultant, and etc. Okay, so that called healthcare professional. So another term we use is a person master index. What is a person master index? It's a patient demographic data. Yeah. When we talk about person master index, it's a patient information. So consists of patient biodata, uh, family data, next of kin data, spouse data, insurance data, employment data, and so on. Yeah, when we talk personal health information, so specific patient information of health record. Yeah. So there are a lot of terms. So I give you this example. So along of this subject, so in lab we will introduce bit by bit, yeah, about the term that will be used. Okay, I think at this level uh, you understand what is the healthcare information system. Before we go to uh, history of the his, yeah. Okay, now we go to the actual contents of this chapter, history and evolution. So the history of the development and implementation of information system in healthcare is most meaningful when we consider in the context of chronology, yeah? Chronology of major healthcare sector and information technology event. Quite difficult to pronounce. So in this section, we explore the history and evolution of healthcare. So I don't want to give a detail, okay, every decade. Just summarize, okay, what was happening in the every decade, yeah, or decade. Uh, History and evolution of healthcare information system in each of the past 6 decades and in the present era by asking several key questions. So when we go through the history and evolution of healthcare in every decade, so we need to ask what was happening in the healthcare environment at the national, for example, the Malaysia perspective, or you can look at the global perspective, uh, you need to ask what happening at the level at the national level that influence organization to adopt or use the computerized system, and what was the state of information technology at the time, and how did the environmental factor coupled with advance in information technology affect the adoption and use of healthcare information system. So that means every decade, so you need to ask, yeah, what happened in 1960? What happened in 1970 era? What happened in 1980? Eh? And then what was the state of information technology at that time? At that time, yeah. For example, in 1970, what happened uh, to the Malaysian healthcare system? Uh, does the Malaysia involved in IT, or they still in the manual system? Yeah. And why you must ask why Malaysia in 1970 era still use a manual system. Okay. And how did the environmental factor coupled with advance in information technology? So example, in 1970, what happened in Malaysia regarding ICT? So what is the level of ICT technology in Malaysia? And you will get the answer that maybe in 1970 the ICT technology in Malaysia is still in the beginning level. Yeah. Okay. In 1960, uh, so this time, his care. We talk about his care, yeah? Or I always said his care is actually SRS only. His. We talk about his only, yeah. What happened his in that decade, and what is the state of ICT and use of his in the healthcare organization. We don't touch other discipline, yeah, or we don't touch another industry. Okay, in 1960, uh, his is focused on the billing part, yeah. So that means in 1960 to 1969, yeah. Hospital information system is focused on the billing part, yeah, billing part. That means on the administrative. So there is no clinical application yet. And ICT during that time is a mainframe computer. I think your generation, I think you never experience with the mainframe computers. Yeah? So this is a remote computer. It's actually the mainframe concept is actually uh, come again in this 2020. Yeah. For example, the application is now stored in the mobile apps. So last time the concept of remote application is implemented in 2020 computer. Yeah. Cloud computing, for example, is remote. So the era of 1960 of computer is come again in 2020 and above. So I can say that in the 1960 to 1969, his is focused on the billing or administrative. So in 1970, clinical department wake up and debut of the mini computer. So that means in 1970, starting from 1970, uh, the his is moved into the clinical part. Yeah, clinical part. Uh, is got a lot of requirement, yeah, got of demand from the doctors and also the researcher. So healthcare insurance via Medicare and Medicaid expenditure rising late in the decade recognition of need to contain healthcare costs. Okay, so it's still uh, his for billing and administrative is still continue. Yeah, and during that time, 1970, mainframe still the famous computer technology, and the mini computer become available. So 1970, it start uh, the supercomputer is started. Yeah, microcomputer also started. Like Unix application operating system is introduced. Yeah, uh, and then work group computer is introduced. But it's not uh, it's not being used in a big scale of the application. So in terms of use of his turnkey system available through vendor community, okay, now in 1970, a lot of vendor come up with the solution. Yeah, they offer the fragmented application, for example, laboratory, radiology, pharmacy system. Yeah, but this time all the application is fragmented. Fragmented mean standalone. Yeah? They are not communicate each other. So in 1980, computer for the masses. Yeah. So that means age of the chip machine is introduced. Yeah, computer uh, in 1980 start uh, decentralized. And this time the personal computer is available, more powerful, affordable, bring computing power to the desktop. Okay, so this is era that we call it client server concept. Yeah, a lot of work group application and so on. So during that time also we don't have internet in Malaysia, for example, but internet in other country is already used. And then use of HRS, a lot of distributed data processing. Yeah, and expansion of clinical information system in hospital. Okay, a lot of clinical information system is computerized or is deployed or implemented in hospital or clinic. Yeah, and physician practice introduce billing system, and they also use the EMR system. Okay, in 1980. But I don't think that during this decade, uh, computer in healthcare, especially in Malaysia, I think still not introduced. Yeah. So in 1990, healthcare reform, initiative and advance of the internet. Okay, 1990, I think I started my career, yeah, for 3 years already. Yeah, I started my career in 1988. Yep, 1988 or 2 years already. In 1990, I still in Bank Simpanan Nasional. Yeah, develop banking system uh, throughout the country. So I don't think that in 1990 we have his in Malaysian hospital. Yeah, maybe some of the private hospital being used, but is what they call it standalone basis. Yeah. So grow So Institute of Medicine call for computer-based patient record. Okay, so now the clinical information system or HIS is demand now. So all the researcher and also the medical professional ask for one system, they call it HIS, to manage the healthcare record or health record for the patient, and also a need of system to manage the hospital. Yeah. So during that time, the unveiling of the internet, yeah, www is revolutionized and also been introduced in Malaysia. Yeah, and the growth of the internet has profound effect on healthcare organization, business, and his product more widely available and affordable, and enterprise-wide system increase internet in clinical application. Okay, so in developed country, I think their his is actually already internet-based application. So during that time, our application in Malaysia is more on the client server base, yeah, no internet base. Okay, in 2000, so WHO called for EMR, World Health Organization called for electronic medical record and electronic health record adoption. So in 2000 and above, consumer empowerment also increased. Yeah, uh, a lot of private hospital is developed and run for business, and because the consumer is looking for a good healthcare services. They don't prefer on the public hospital. They prefer on the private hospital because private hospital can serve uh, very fast and good healthcare services. So in 2000, year 2000 and above, or 2000 decade, internet and broadband access in rural area is normal. Yeah. So I think same in Malaysia. So in year 2000, the internet broadband also is already installed in certain rural area. Yeah, and portable device become widespread. For example, a smartphone. Yeah, last time we use iPod. Yeah, iPad, uh, tablet, and so on. And wireless technology, Web 2000 technology, standard and connectivity is introduced. Yeah, so his become demand and very important in managing the healthcare services for healthcare organization. And now in 2000, focus on EHR system. So vendor promote uh, CCHIT, yeah, clinical care health IT certification for those uh, who engage with the EHR system. So the healthcare organization invests in information system that promote safety, for example, CPOE, yeah, clinical product order entry, yeah, medication administration, e-prescribing, and other decision support system. Yeah. So all system, clinical system is developed during that time. So what happened in 2010 and 2020? So the his is become crucial in managing healthcare organization. Okay, so in 2010, his hospital information system is expected to become a seamless and borderless. Healthcare information system is seamless and borderless, can be accessed anywhere. So the internet is a instrument or the transport, very important transport for transporting the data, yeah, or viewing the data anywhere and at any time. And during that time, the big data is come to the picture, a mobile application, and his application is focused on the intra and inter healthcare provider. So in 2020, so his or healthcare information system become what they call it now in the era of digital health. Everything is digital and is called like supply change, yeah, from the beginning until the end of the of managing the hospital is digital, yeah. And ICT now we heard about the cloud, IoT, big data, and data science in healthcare system. So healthcare information system is very important in 2020 because the healthcare organization uh, now talk about the optimization of the cost, to reduce the cost, and then the healthcare policy like to look at the data to do a preventive of health, yeah, to run a program of wellness and so on. So they need the data, and the data science is very important to do a preventive or prediction of the health of the certain country, certain citizen in the country. So he's normally implement in intra or extra uh, intranet or extranet, and global healthcare services is the focus because poor countries, so they need the help, specialists from the developed country. Yeah, for example, in Uganda, Ethiopia, they got a lot of poverty community. So the main problem is healthcare services is very poor. So they need specialists, and the telemedicine or telehealth is very important during this time. So class, this is very lengthy lecture on the history. So I'm not a history lecturer. So, but I try to share with you from 1960, 1970, 1980, 1990, 2000, 2010, and 2020. What is the landscape of the HIS in the healthcare, and why his care, again his care, why HRS is very late to be adopted in the uh, healthcare organization. Okay, so as you can see that the state of ICT is very late adopted in the healthcare organization. We start with mainframe, yeah, step by step, and of course the focus of HIS is administrative first, and then they move to the uh, clinical information system. You see, from 1960 until 1990, then they start the electronic medical record. Yeah, very long, uh, a long period of time to adopt for the use of his or electronic medical record in the healthcare organization. So you can see that from the state of ICT, use of HIS or HIS environment, so you can learn from that. So the technology and healthcare business cannot be computerized easily, yeah, because it involves a lot of process standard, and also the uh, confidentiality of the information. Okay, why healthcare lag in IT? So I can summarize in 4 factors why healthcare lack in IT. First is healthcare information is very complex. So when you go to the hospital, there are many department or discipline. Yeah, when I talk about discipline, means department. For example, outpatient discipline, inpatient discipline, cardiology discipline, what they call it, cardiology department. Discipline and department is same. Okay, and then pediatric discipline or department. What else? Ophthalmology department, orthopedic department, neurology department. So, uh, according to my term that I use, it already looks complex. So, it is difficult to computerize because the healthcare is very complex compared to the banking industry. Is very straightforward. Yeah, it involves money, available account, uh, what they call it, uh, current account. Sorry, yeah, current account or saving account, credit card. So they involve only the debit credit. Yeah. So, but healthcare is very complex, involve many discipline, and first and very important is involve a human. Yeah, involve human life and death. So the healthcare information may include, yeah, this is another complexity, text, images, pictures, and other graphics. But when you compare to the banking system, is everything is text, yeah, and number, numeric, account number, and value. So how much your available balance and how much your uh, floating amount and so on. That's it. All involved in the figure. But in healthcare, you involve a multi-type of data, tag, images, pictures, wave, and so on. So this is no simple standard operating procedure. The provider can turn to for diagnose, treatment, managing, and individual patient care. So for each of the patient, so the data involved is a tag, image, picture, and other graphic data. So you just imagine that some of the patient only have text, some of the patient only have images, some of the patient got all type of the data. So to manage or to design the database is also complex. So although there are standard of care and practice guideline, the individual provider still play a pivotal role in conducting the physical examination, assessment, and history of the patient. So apart from your medical data, so doctor sometimes do a physical examination of you. So they check your chest, your back, right? So how to convert this information, this examination into the data. So this is another user interface or user experience to be designed. Yeah? So in other words, we back to the first uh, reason why healthcare lag is healthcare is complex. So second is health information is highly sensitive and personal. So highly sensitive and personal means very confidential. So this is involve personal data, yeah, involve personal health habit, yeah. Let's say you monitor uh, your what they call it uh, weight program, yeah, or smoking program, stop smoking program. So this involve a personal health habit. Yeah, let's say you involve in you got problem with health mental. Yeah, so this is also involve health habit. Yeah, you will inform the doctor about your history, yeah, about your habit and so on. So this is very sensitive and personal information. You talk about family history. This information is very important for a medical professional uh, to get a real picture of their patient. And then when they got this information, so that uh, they can make a decision, treatment decision correctly. Yeah. Otherwise, the treatment plan is not right, is not accurate. uh, and sexual orientation. So this is very private. Yeah. So yet such information may be relevant to the accurate diagnosis and treatment of the patient. Like I said, if you don't give the information correctly, so difficult for the medical professional to plan the right and accurate treatment plan. Okay, so every patient must feel comfortable sharing such sensitive information with healthcare providers and confident that the information will be kept confidential and secure. So that's why in Malaysia it's very difficult to implement uh, the EMR, because some of the I think sorry, in developed country very difficult to implement the EMR. They're very concerned about the uh, medical record to be kept in the computer, in the database. So what the IT procedure implement to enable that the medical record can be saved. So we introduce the consent letter. Yeah. Okay. Another reason is healthcare ICT is expensive. You just imagine one total hospital information system in uh, Hospital Sedang, Putrajaya, involve multi-million ringgit. Yeah. It's not easy to develop, and it incurred a lot of cost, especially the expertise and also the equipment. Yeah, equipment uh, where the system will integrate with the medical equipment. That's very expensive. And then finally is fragmented or non-integrated system. So this is a very common problem. Yeah. Um because the application started when you look at the 1960 decade. Yeah, they start with a mainframe system. All the system is standalone, so the system is used for sometime 20 years, 30 years ago. And then when come to the new application, the new system, so the vendor is already gone. So how you want to integrate with the new system, and how you want to do a conversion, data conversion. uh, so you cannot throw away the data, because the data uh, is 20 years or 30 years ago, in the database. So when the new system is developed, so the old system data need to be converted or migrated to the new system. And this is very big problem nowadays. So there are a lot of solution, but in term of the technology is very easy, but in term of the people, how to integrate. Yeah, because the system in one hospital may have more than one vendor. So when the new vendor come for integration, so they're very difficult to communicate. They're not willing to disclose their system to other vendor. So this is a problem. So the best solution is the new hospital. When the new hospital is developed, for example, in Hospital Sedang, Hospital Pelajaya, Ampang, what else in Sultan Bahaya in Kedah. So they start with the new system. They start from fresh when they develop the system, and then when they develop the hospital, then the computerization of the hospital include the application HRS. So it start with the fresh, and then a single vendor, and I think that is the best way how to implement the HIS. Okay, there are 4 reasons, why healthcare lack in IT. So in summary, HIS involve many terms that used for communication among health. Like I said, the healthcare ICT start with a focus on managing and administrative and financial matters of healthcare organization. So healthcare system is complex, sensitive, confidential, expensive, and fragmented, lead to late adoption. So why I bring you into this history and evolution, so that you can answer this question. Yeah. So the reason is to bring you to ask you to think about the why and what are the lesson learned that you can take away from the history and evolution of his from 1960 until 2020, that you can bring uh, the best practice, for implementing new healthcare city project. When you manage the project, what are the best practice that you can adopt, or you can suggest uh, for make it the implementation of healthcare information system in certain healthcare organization can be succeed. Okay, another question from the history and evolution of healthcare, from the HRS implementation from the 1960 until 2020. So you can see that why the HRS is expensive, and why uh, they are fragmented. They are implemented in fragmented way. Yeah. So I expose you to this situation uh, because we have to look at the back side, the problem side. ICT services is to resolve the problem. So anywhere you go, when you got the project uh, for computerization of hospital, so you need to look at these 2 things, to get the cheaper solution, and how to resolve the interoperability, how to resolve the integration issue, where uh, this is typical system in the hospital, they are fragmented. So between 2 main application in his administrative and clinical, so you can give a opinion, from the lesson learned of the his implementation from 1960 until 2020. So which of the application need to be focused when, or need to be prioritized when we want to implement or deploy the application to the health organization, either administrative application first or clinical application later, or vice versa. Okay, so based on the history, you can see that the application is focused on the administrative function first. Then after that is clinical function. So this you can learn that, yeah, from the history. Or we cannot, maybe, yeah, this is maybe, maybe you cannot implement the clinical application first, but you need to cater the administrative function first, because uh, the focus of the hospital is to manage the patient and control the financial part. So this is administrative. So you need to uh, complete, or you need to develop the administrative application first, so that after the administrative uh, is implemented accordingly, so you can manage the uh, medical professional easily, yeah. Because if the administrative function is not implemented clearly, then it become havoc, yeah. So the health worker that work in the administrative department, so got problem, and then when the order come to the lab, so the lab fees is not cannot be charged, yeah, because uh, the price and also the cost of the healthcare cannot be calculated. So he got havoc in the hospital. So I think, from my experience, so this can be decided collectively, from the team. And of course, when you want to decide something, you need a data. So what the data is? The history, yeah. From the history you can learn, yeah? That I call it lesson learned, yeah, from the history. Okay, try to answer these three questions. So you don't need to submit, but practice yourself. Example between two main application in his administrative and clinical. In your opinion, which one should be given a priority to be developed? Support your answer with the fact that you read from the literature or observation. Okay, let's say you say that administrative important, first priority, then support it. Yeah, your answer. Okay, class. I think that's it. It's a very lengthy lecture, but this is very important uh, information for you to know from the history. Yeah, because uh, my concept is, history is a history, but history is very important to learn, because you got a lot of lesson learned from that. Yeah? What is good, what is bad. Yeah. So so from that, you when you manage a project in healthcare, for SRS in healthcare, so you know the bad and good things to be implemented. Okay, that's it. See you later, and try to answer this question. Okay, class. See you later, and thank you very much.